Good evening, how are you? I wish you are fine. I'm Dr. Bassem, I'm plastic surgeon. I want to speak about one of the inherited abnormalities of deficient wound healing. It's Ehler-Danlos Syndrome, cutis hyperelastica. Cutis hyperelastica is rare, usually autosomal dominant disorder characterized by fragile hyperelastica and easily bruised skin, joint hypermobility, and aortic aneurysm. Abnormal molecular cross-linking of collagen leads to poor wound healing. The skin has a low tensile strength and doesn't hold suture material. The surgeon must clearly distinguish the patient with cutis hyperelastica from the patient with cutis laxa, because elective procedures in patients with cutis hyperelastica are fraught with disaster. There are numerous types of Ehlers-Danlos syndrome, each of which has its own set of dangers for the plastic surgeon. You will see a video about this case. You will be astonished and surprised about this. One of the 24 surprising symptoms of Ehlers-Danlos syndrome is the hyper elasticity of the skin. Ehlers-Danlos syndrome (EDS) is a group of disorders that affect connective tissue, which is like the glue that holds our body together. When the connective tissue is faulty, it can cause joints to sublux or dislocate completely and can make the skin stretchy and fragile. However, Ehlers-Danlos syndrome is a complex illness and can cause many serious physical issues beyond simply being flexible. In order to better understand the different ways in which Ehlers-Danlos syndrome can affect people, we asked our mighty community to share some of the physical symptoms of Ehlers-Danlos syndrome that surprised them. Have you experienced any unexpected symptoms as a result of Ehlers-Danlos syndrome? Let us know in our comments below. Here is what the community shared with us. Being very bendy but being in pain. People associate pain with being stiff, but that's not always the case. Second, gastrointestinal issues like bloating, diarrhea, constipation, difficulty absorbing nutrients, nausea, acid reflux, etc. People are always surprised by these symptoms, as I was. But Ehlers-Danlos syndrome can affect your organs, bladder, and bowel movement as well. Some people with Ehlers-Danlos syndrome need a feeding tube and have trouble gaining weight. The sheer inability to relax my body for fear a joint will sublux at any moment. I can sleep all night and wake up feeling like I ran a marathon from trying to keep my body in one piece. Joint the bendy bunch group to connect with other people living with hypermobile Ehlers-Danlos syndrome. My teeth being so weak, I am in the process of getting upper dentures now, and next year we have to take out all my bottom teeth too. I'm only 25. Hormone imbalances. Secondary conditions like dysautonomia can cause adrenal problems which affect other hormones and hormone production. Velvety soft skin that is surprisingly fragile, headaches from postural problems. I can hardly keep myself upright and I just slip into a hunched position and then I get horrible headache that stop me from even being able to move. Fatigue. I get tired doing next to nothing and it can take days to recover from things I used to be able to do without thinking. I never thought bendy joints would make me this exhausted. My eyes are so badly affected, I'm registered blind. Being klutzy. I have always managed to bump into everything, walk into door frames, slam my hands into counters, or fall into chairs. Turns out, Ehler Danlos Syndrome causes poor proprioception, which basically means we are really bad at telling where our bodies are in relation to other things. Scratching can either tear skin or leave huge friction burns that in turn take forever to heal and almost always leave a scar. The lack of muscle tone. I have Ehlers-Danlos syndrome and I don't have a lot of muscle tone from the waist up. My legs are fine because I am not able to walk a lot on campus and at work, but above my waist I am extremely skinny and can't lift much. I attempt to lift weights and work my muscles, but I either sublux or dislocate a joint, so I am unable to uphold much muscle mass there. Long tongue, with little to no frenulum, so that they can lick up the tip of your nose. Gorlins sign. Owl neck. Have to be very careful driving when looking over shoulder. To not look all the way back, but to look just over my shoulder. Small mouth with crowded teeth. My mouth is abnormally small and I had to have 8 permanent teeth removed in order to have braces. I have to cut my food really small and I have hard time eating it. The complete inability to sleep in bed due to pain. I have to sleep propped up with pillows on the sofa, and even then I still sublux joints in my sleep, but at least it minimizes the excruciating rib pain I get if I sleep in a bed. The need for a port because of failing veins. My veins are too weak to hold simple IV, so a port became necessary. That is just ridiculous. Having suction cup, flat feet, because you don't have any collagen to form an arc. My feet literally suction to hard floors and make audible suction noise. Moist mouth and jaw pain. Surprised bruises. You don't know how to get them, but damn, they are colorful. Randomly feeling like you have the flu. Dental issues. Plaque being stuck in weird places because we can have an extra flap or extra skin in our mouth that holds the plaque and stuff in a place others don't have. We look younger than we are. Due to the collagen being extra stretchy, we may seem younger, less wrinkles. Gotta look at the plus side. And in general, they feel that they see at the bright side of the subject that they are looking young. What is Ehlers-Danlos Syndrome? Ehlers-Danlos Syndrome is a rare condition that appears in at least 1 in 5,000 people worldwide, according to the National Institutes of Health Genetic Home Reference. More people became aware of the syndrome in October 2019 when famous singer-songwriter Sia revealed in a series of tweets that she had Ehlers-Danlos Syndrome. Others with Ehlers-Danlos Syndrome responded in droves online, often referring to those in their community as zebras. According to the International Ehlers-Danlos Society, the reference to zebras is borrowed from a common expression heard in medicine. When you hear hoofbeats behind you, don't expect to see a zebra. In other words, medical professionals are typically taught to look out for more common ailments rather than testing for ultra-rare diagnoses. Due to this approach, people with EDS and related disorders can sometimes be left in the lurch, hunting for explanation about their health that few doctors can readily provide. The Ehlers-Danlos Syndrome community adopted the zebra as its mascot because sometimes when you hear hoofbeats, it really is a zebra. In this spirit, the Ehlers-Danlos Society includes patients, caregivers, health care professionals, and supporters working towards a time when a medical professional immediately recognizes some with an Ehlers-Danlos syndrome. What causes Ehlers-Danlos syndrome? Ehlers-Danlos syndrome disrupts the integrity of connective tissue in the body that normally supports the skin, bones, and blood vessels, as well as many muscles, according to the NIH. The condition may range from mildly bothersome to potentially life-threatening. Although the syndrome manifests differently in different people, many patients with EDS display a large range of joint movement known as hypermobility, poor muscle tone, and loose velvety skin prone to bruising and scarring. These symptoms are not universal. As of 2017, a diagnostic manual titled The International Classification for the Ehlers-Danlos syndromes characterized 13 distinct forms of EDS, each with its own array of defining features and underlying causes, according to the National Organization for Rare Disorders. Many of these forms share characteristics such as unstable joints or fragile heart, valves, and blood vessels, but specific traits may be unique to particular subtypes, according to the Hypermobility Syndrome Association. Despite their wide variation, most forms of EDS appear to stem from related genetic mutations, according to NORD. Some of the affected genes contains instructions for building collagen, a fibrous protein that strengthens connective tissue throughout the body and comes in a variety of subtypes. Other genes help determine how the body processes collagen and how other structures interact with the protein, and these genes may also have functions beyond those related to connective tissue according to the NIH. A mutation related to EDS can be passed from parent to child either as a dominant trait, meaning the child needs to inherit only one copy of the mutated gene to develop the syndrome, or as recessive trait, which means one mutated gene must be inherited from each parent. Occasionally, the mutation may not be picked up from either parent, but instead occur spontaneously in an egg or sperm. According to Nord, specific genetic tests can help families determine how much syndrome manifests among their relatives. In all, 19 genes appear to be associated with 12 different forms of the syndrome. The only subtype without a gene mutation associated with it yet is the hypermobile EDS subtype, also known as HEDS, according to the Hypermobility Syndrome Association. Diagnosis and treatment. Physicians typically diagnose EDS based on patient history, clinical examination, and genetic testing according to Nord. Doctors can evaluate how extensible the skin is by gently pulling at it, and they may determine how mobile a patient's joints are based on a measure called the Beaton scale. Imaging tests including CT scan, MRI, and X-ray scans can help doctors spot structural abnormalities in heart, valves, blood vessels, bones, and other tissues. Doctors may also take tissue samples to examine collagen structure more closely. Genetic tests help doctors to determine which specific subtypes of Ehlers-Danlos syndrome a patient may have. The Ehlers-Danlos Society has a free, handy checklist of criteria to review for an EDS diagnosis. Related 7 diseases you can learn about from a genetic test. Although there is no cure for EDS, doctors often prescribe medication to help patients cope with troublesome symptoms according to the Mayo Clinic. Depending on the subtype, these drugs may include those for pain relief or blood pressure control. Physical therapy may be recommended to help strengthen muscles and stabilize joints that may otherwise dislocate. EDS patients sometimes need surgery to repair joints that dislocate repeatedly, as well as ruptured blood vessels and organs in certain subtypes. Screening for hypertension and arterial disease should be done regularly after diagnosis, adds North. Physicians recommend that patients with EDS avoid contact sports, weightlifting, and other physical activities that could place those individuals at risk of injury, particularly to the joints, according to the Mayo Clinic. Exercises like walking, swimming, doing Tai Chi, and using a stationary bike are good options for staying active while minimizing stress on the body. Depending on the symptom severity, doctors may recommend that patients stay away from difficult to chew foods, as this may injure the jaw, and playing musical instruments that may put strain on the lungs, such as reeded wind or brass instruments. EDS patients, particularly children, can greatly benefit from a supportive network of family and friends who understand their condition. The Mayo Clinic adds, emotional support, advice, and educational materials can also be found to help those peoples. According to Ehler-Danlos Syndrome, I put a video on Instagram, and some of the followers were astonished about it. A part of one of them tells, a part of my severe bleeding disorder, I also have Ehlers-Danlos inherited from mom too. Ehlers-Danlos syndrome is a group of inherited rare disorders that mostly affect the skin, joints, and blood vessels. Ehlers-Danlos syndrome affects connective tissue, primarily the skin, joints, and blood vessels walls. Symptoms include over-flexible joints that can dislocate and skin that's translucent, elastic, and bruises easily. In some cases, there may be dilation and even rupture of major blood vessels. I have to use these. She put a picture of the splints for now, and then I need to buy the silver rings because I have Swan Neck in my fingers due to the hyperflexibility, hyperextension, and subluxation in them, making painful to write, to make handmade, play sports, etc. These finger rings or splints help my finger joints full range of motion, block the hyper flexibility is painful syndrome and affect all my joints, fingers, neck, ankle, elbows, arms, shoulders, face, jaws, headache, legs, arms, eyes, and make me had a hard time. Although this condition make me bleed more. This is one of the patients who is suffering from it talking. This is a whole video about Ehlers-Danlos syndrome. I wish that you will like it. Please make like, subscribe to my channel, and activate the bell and share with friends. Welcome, I'm Dr. Bassem.